Welcome to Wax Off. My name is Robina Rayasat and I'm a hearing aid audiologist. I'll be talking through our earwax removal videos, so let's see some wax. This patient, let's call him Hot Pie. Hot Pie has been trying to get wax out of his ears and has inadvertently pushed the wax deeper in. I start off with the right side and instantly you can see how oily and deep everything is. I go in and there's lots of oil, not a very good view, but you can see that the oil is being suctioned up beyond the hairs. On the second attempt, I'm able to get past the hairs and see the wax, and you can almost feel just how soft it is. It's so deep, I'm gently allowing the suction tip, a large Zollner in this case, to touch the surface of the wax. Back in after an endoscope wipe, one of very many during this procedure, and getting through the hairs doesn't coat the endoscope with oil this time, so I'm able to get a great view and start to remove some of the side keratin. I've switched to a smaller probe here for noise reduction purposes and I'm blanketing. Only a small amount of surface wax comes off though, but it's a start and we have to trust the process. Some more blanketing which doesn't remove that piece of keratin which seems to be firmly stuck on the side, but does remove some more surface wax. It is quite a hard piece that has come off here, together with lots of soft wax which went into the tube, so not much to see. Back in through the hairs and gently on the surface, I'm probing for the best area to attach the suction tube on, and suddenly there is movement of seismic proportions in the background. I come out to reposition my brace and the blockage attaches and moves around a little. And out it comes, an unclear view because of the oil, but a huge dark blockage which has been sitting on the eardrum. And here's the final shot of the right eardrum, completely red at the top, a little bit distressed looking and a bit thickened too. It's red because the wax was sitting on the eardrum, but this will go away after a while. Onto the left side, this side is just as oily as the right side, but not a completely sealed blockage. you can see there's a slight burgundy piece of keratin and wax mixed at the top here, which I think is dried up blood. And I begin. Through the hairs, I'm aiming my probe to the dried piece of wax, and it attaches immediately. Some chopsticking going on here. I want to be super careful to ensure that I'm not going too deep, because this wax is positioned very deeply and I don't want to do any damage, but it doesn't want to attach. And here, with a limited clear view, I suddenly have attachment of the blockage, because sometimes the most beautiful things can come out of the messiest situations, and this is definitely one of them. Here you can see there is a slight change of view because I've inserted the endoscope slightly differently, and we have an even better view of the wax. After this, I have oiled more to get everything lubricated. This clip shows just how narrow the entrance of the ear canal is, which is why it's so difficult to get the probe through. However, now I have someone holding open the ear canal, you can see the difference in the aperture width. Much easier to get the probe in. I've kept the probe, placed them a little further out in this view to prevent that chopsticking, but you can clearly see at the end of the probe I'm blanketing the keratin over the wax, and now we have some movement of the blockage. And here it comes. Some has broken off and gone into the tube, but I'm still able to hang on to the wax just about at that moment where it wants to break off, but I'm able to keep hold of it. Again, the pinner or the outside of the ear is being gently pulled on the outside here to help open the ear canal. And we have another piece of wax, but you can still see there's some left on the eardrum. Not a brilliant view here because of the oil, but here I managed to get the little piece left over on the eardrum. And here we have a final view of the eardrum, a little red again, but to a lesser degree than the right ear. Looks healthier and more in line with a normal eardrum. Thank you so much for watching today. Please keep liking, subscribing and sharing my videos. The algorithm has been a little tough on my channel recently, so all your interactions with the channel, including comments, make so much difference. I know we'll break through it at some point. Keep watching. It's peace out from me, and I will see you in the next one.